So thank you very much, Chris. Thank you. Wow. Thank you very much, TCU, and thank you very much to the Zoota family. Delighted to be here today. So how many here would like to figure out why they have Parkinson's disease? How many people would like to slow their Parkinson's disease? And how many would like to prevent their children, their grandchildren, friends and family from getting it? All right, we're all aligned, and we're going to give you answers to each of those questions today. So I want to talk to you about our new book, The Parkinson's Plan, our goals and our progress. And along the way, I want to figure out why you have the disease, because almost everyone in here wants the disease cured. The prerequisite to curing a disease is knowing its cause. The prerequisite to curing a disease is knowing its cause. Everyone's nodding their head. That makes a lot of sense. But right now, most of you don't know why you have Parkinson's disease. So how can you cure a disease when you don't know its cause? In fact, I can't think of any disease that we can cure medically where we don't know its cause. And I can think of lots of diseases, like, remember, bleeding ulcers, that we figured out what its cause is, we can cure it. Hepatitis C we can cure with pills. Pneumonias we can cure. So there's lots of diseases we can cure once we know its cause. So I want us to figure out what the causes of the disease are so we can cure it, so we can prevent it, so we can slow it, and so we can treat it. As many of you know, Parkinson's disease is one of the world's fastest growing brain diseases. In 1990, it's estimated that 2.6 million people had the disease worldwide. Right now, the latest estimate is that nearly 12 million individuals have the disease. A fourfold rise in just 30 years. And so what's explaining this rise? Aging is contributing to some of it, but even if you adjust for aging, it's growing faster than that. Genes don't change that much in the span of 30 years. The only thing that really changes in the span of 30 years is the environment. And so environmental toxicants in our food, water, and air, chemicals in our food, water, and air are fueling the rise of Parkinson's disease. Now, Parkinson's disease is not a natural consequence of aging. If I put a mouse into the laboratory and let it age, it will never develop Parkinson's disease, nor for the matter will it develop Alzheimer's disease. The only way that mouse develops Parkinson's disease is if I manipulate its genes or expose it to toxic chemicals. So the rise in Parkinson's disease is not a natural consequence of aging. It is an unnatural consequence of aging. And then when Michael Oken and I, Michael Oken, my fellow author, and I look at this graph, we see our report card, and it's going in the wrong direction. It's on our watch that Parkinson's disease has become one of the world's fastest growing brain diseases, on our watch. And our colleagues answered the bell when it came to HIV. Our colleagues have answered the bell when it came to COVID-19. Our colleagues in stroke are answering the bell. The incidence, the number of new cases of stroke is going down. Mortality, death due to strokes is going down. They have answered the bell. But we have failed to address the needs of the Parkinson's community. We have failed to address the needs of the Parkinson's community, and that's why Michael and I are going all around the entire country to get the word out about how we can prevent, slow, treat this terrible disease. And so in the book, we actually give you a plan, and the plan is PLAN, to prevent the disease, learn why the disease begins, amplify the voices of everyone in this room, and navigate the new frontiers of treatment. And we'll go through each of these. So many of you say, well, Parkinson's disease has to be due to aging. You know, young people generally don't get Parkinson's disease, and that the disease begins slowly over time. And indeed, you're right. It is really, really rare for people under 30, for example, to get Parkinson's disease. I'm sorry, this is the graph of the incidence of Parkinson's disease by age. This is the number of new cases of Parkinson's disease per 100,000 people, and this is age. And so it's really, really rare, right? Almost no one gets Parkinson's disease when they're really young. And the number of new cases of Parkinson's disease increases as people age. And in most parts of the world, but not all parts of the world, more men have the disease than women. And you can see that the incidence of Parkinson's disease, it triples every decade. So it triples from the 30s to the 40s, 40s to the 50s, 50s to the 60s, 60s to the 70s. And so longevity, increasing lifespan, allows time for the disease to become manifest. Many of you know that how many of you had symptoms before you were diagnosed? Right? So you know the disease begins over long periods of time. In some cases, it begins over you've had symptoms for years or decades before you develop the disease. And I'm going to talk to you a lot that the seeds of Parkinson's disease, the reasons why many people in this room have Parkinson's disease is because they got exposure when they were young. Young, like drinking well water in rural areas. Well water is prone to contamination from pesticides, or early job exposures. When you're young, the seeds of Parkinson's disease are planted early. Now, so this is the graph of the incidence of Parkinson's disease, but I'll show you another disease. This is lung cancer. So the incidence of lung cancer is extraordinarily rare before 30s or 40s, and then it triples every decade, beginning in your 40s. And in most parts of the world, it's more common than men than women. Do people think that lung cancer is caused by aging? No. What causes lung cancer? Smoking. So 125 years ago, in 1900 United States, lung cancer, which is the leading cause of cancer death in the United States, it simply did not exist. Lung cancer just did not exist. It was so rare, that people, when they saw it, they considered it a once-in-a-lifetime oddity. They gather all the students and physicians around, thinking that they would never see another case. But 25 years after cigarettes are introduced in the United States, you see a corresponding rise in lung cancer deaths. Smoking in the United States peaks in the 1970s. After it peaks, 25 years later, you see the decline of lung cancer. So if we can treat or prevent lung cancer, we can prevent Parkinson's disease. Almost the identical graph. So when people say that Parkinson's disease is due to aging, that is wrong. The only thing the main thing, I speak in hyperbole occasionally, the only thing that it does is allows the disease to become manifest, because it takes years. By the time you're diagnosed with Parkinson's disease, 60% of the nerve cells have died off. Parkinson's disease is not an inevitable consequence of aging. John Adams, age 90, is writing to Thomas Jefferson, age 83, in 1826, right? Neither of them have Parkinson's disease, neither of them have dementia, right? No president until President George H.W. Bush had any Parkinsonian disorder. None of them until Reagan had Alzheimer's disease. These are not natural consequences of aging. These are unnatural, artificial consequences of aging brought about chiefly by chemicals in our food, water, and air. Now, some of you say, well, what about genes? So there are some genetic forms of Parkinson's disease, but they're rare. There's a great study led by the Parkinson's Foundation called PD Generation. Anyone participate in PD Generation? No one participate in PD Generation? We've got to get them out there. It offers free genetics. It's an ongoing study. It offers free genetic counseling and genetic testing to anyone with Parkinson's disease in the United States and several other countries. And they looked at the results for the first 8,000 participants, 8,000 individuals, an incredible study published in one of the leading journals called Brain just last year. And they looked at people with Parkinson's disease, and sure enough, 13% of Americans with Parkinson's disease carry a genetic cause or genetic risk factor for the disease, 13%. Said another way, 87%, the vast majority of Americans with Parkinson's disease have nothing to do with any known genetic cause or risk factor for the disease. The vast majority of Americans, the vast majority of people in this room have no gene that increases their risk for Parkinson's disease that we know of. Two explanations. One, we've missed it, but there have been 35,000 studies of the genetics in Parkinson's disease, and my colleagues who are geneticists are really good, and I don't think they missed the major ones. I'm sure there's some small ones that they might have missed. Or that Parkinson's disease has little to do with genetics and a lot to do with the environment. The same study was replicated by researchers in Europe who looked at individuals with Parkinson's disease in Europe, North and South America, and the Middle East. And they found in their study that 15% of people carried a genetic cause or genetic risk factor for the disease. Said another way, 85% of people in their study do not carry any genetic cause or genetic risk factor. Now, it's a little bit more common if you have a family history of disease, 20% carry a genetic risk factor. If you were younger, if you had age of onset before 50, it was 20%. Age of onset before 30 was 30%. And then if you had age of onset before age 20 and a family history of the disease, I've never made this diagnosis in anyone, it was still a coin flip as to whether you had a genetic cause or genetic risk factor. So again, for the vast majority of people, 85% of people throughout the world do not carry any genetic cause or genetic risk factor of disease. So longevity allows time for the disease to become manifest, and genes have very little to do with it. The principal causes of Parkinson's disease do not lie within us. They lie outside of us in our environment, chemicals in our food, water, and air. So what are these chemicals? The first are certain pesticides, including a pesticide called paraquat. How many people have heard of paraquat? Yeah, so paraquat is a weed killer. It's sprayed in Texas. It's sprayed in Texas today. Over 50 countries, including China, have banned a weed killer that's still sprayed in Texas today. You guys are Texans. I didn't think that Texas followed China. And so paraquat is considered one of the most toxic weed killers ever created. It kills the weeds that Roundup doesn't. It's been used to commit homicide and suicide. My colleague, Dr. Caroline Tanner, who's a Parkinson's specialist like me, but has a PhD in epidemiology, showed in 2011 farmers who worked with paraquat have 150% increased risk of Parkinson's. Farmers who work with a weed killer sprayed on cornfields, soybean fields, cotton fields, and vineyards have 150% increased risk of developing Parkinson's disease. In 2023, my colleagues Dr. Kimberly Paul and Beata Ritz at the University of California, Los Angeles, found that individuals who simply live or work near where paraquat is sprayed have a doubling of their risk of Parkinson's disease. So it's like smoking. You don't have to be the smoker to be at risk. You can simply live or work near where the smoker is and be at risk for the toxic effects of the weed killer. Use of paraquat in the United States, according to the most recent data that I can find from the U.S. Geological Survey, is not decreasing. You would think it would be decreasing, but it's actually increasing. The amount of paraquat sprayed on fields in Texas and throughout the United States has doubled in the last 5 years for which data are available. Along with it are the seeds of future cases of Parkinson's disease, and I think possibly along with it are increasing the rate of progression of people who already have the disease. How many people live near where paraquat is sprayed? How many people grew up near paraquat, do you think? Yeah. The second major cause, and I think even possibly more important, is a chemical called trichloroethylene. How many people have heard of trichloroethylene? Few people. So this is, I didn't know about trichloroethylene. Almost everyone in this room, including me, have been exposed to this chemical. It's been around for 100 years. It's called trichloroethylene because it's made up of 6 atoms. All of you know that water from high school chemistry is made up of 3 atoms, H2O, 2 hydrogens and 1 oxygen. Trichloroethylene is made up of a whopping 6. So it's very simple. It's 2 carbon atoms in black, 1 hydrogen in white, and 3 chlorine atoms in blue, hence its name trichloroethylene. It's got a cousin named perchloroethylene that's still widely used in dry cleaning. Dr. Tanner and her colleague, Dr. Sam Goldman, showed that twins who had hobby or occupational exposure to these chemicals had a 500% increased risk of developing Parkinson's disease. And in their paper, because this chemical is so widespread, use was so widespread, said that the potential public health implications of their study are substantial. So this chemical is known to cause cancer. The EPA says this is carcinogenic by all routes of exposure, so that means inhaling it, coming into contact in the skin, or ingesting it. So trichloroethylene is associated with a 500% increased risk of Parkinson's disease. It's been used to everything from decaffeinating coffee. So if you drank decaffeinated coffee in the 1970s, you quite likely had a good chance of drinking this. And then it was used to degrease metal, and it's used to dry clean clothes, especially its cousin is much more commonly used, perchloroethylene, used to dry clean clothes. And then it has a wide number of uses that I'll show you in a little bit. And the third major contributor, I think less important, but actually still important for Texas, is air pollution. So when you see air pollution, you can see it on the screen right there. Everyone's seen air pollution, right? Everyone has seen air pollution. What you're actually seeing is little pieces of dirt and soot suspended in the air. Those pieces of dirt and soot, the fancy term is called particulate matter. And most of that particulate matter, most of those pieces of dirt and soot are big enough that we sneeze them out or we cough them out. But some are so small that they can go directly into the nerve responsible for smell. Some are so small, 1/30th the width of my hair, yes, this kind of sounds disgusting. They can go in, penetrate the nerve responsible for smell that hangs up in our upper nasal passages. And hitchhiking on this particulate matter are lead from leaded gasoline, iron from brakes, platinum from catalytic converters. And these toxic metals can lead to a misfolding of a protein called alpha-synuclein, misfolding of a protein that will start in the nose and then make its way back to the part of the brain that's affected in Parkinson's called the substantia nigra. And so many of you know one of the earliest features of Parkinson's is loss of smell. And the most common place that you find the pathology of Parkinson's disease is in the olfactory bulb, or the smell center of the brain. So the most common place you find the pathology of Parkinson's is in the smell center, and it appears that one of the earliest places you find it is also in the smell center, suggesting that the Parkinson's for many individuals begins in the smell center and then spreads backwards. You can actually get back to the substantia nigra by making one change. Like think about stopping in Dallas-Fort Worth if you're flying from the West Coast to the East Coast. You're flying an airplane, you switch, you stop at the amygdala, and then you switch planes and you go back from the amygdala to the substantia nigra. And so this misfolded protein can spread from nerve cell to nerve cell, and with just one stop in the part of the brain called the amygdala, you can then get back to the substantia nigra and produce Parkinson's disease. So we're going to talk about each of these a little bit more. So this is a map of where paraquat is sprayed in the United States in 2018, and you can see it's sprayed in almost every state in the country. And if you look at the map, of where Parkinson's is highest, for example, one of the places where Parkinson's is most common in the United States is the Central Valley of California, where you can see where paraquat is highly sprayed. So many farmers in the Central Valley of California got Parkinson's disease after spraying paraquat that they've sued the manufacturer. And as part of those lawsuits, the manufacturer had to turn over documents about what they knew. And according to the reporting from The Guardian, a chemical company had done research studies with 3 different Can't hear. We'll try. That better? Yeah. They had done research with 3 different species of mammals. They had exposed mice, rats, and rabbits to paraquat, and they developed the features of Parkinson's disease, including tremor. The chemical manufacturer, according to the reporting from The Guardian, had done these experiments in the 1960s. Academics hadn't made those discoveries until the 1990s. So we're still spraying a weed killer on farms in Texas, in the United States, that's been around since the 1960s, and we've known about its toxic, or people have known about its toxic effects for 60 years. And we wonder why Parkinson's disease is one of the world's fastest growing brain diseases. This is trichloroethylene. That's the fancy chemistry. And this is the list of occupations and uses of it. In 1970, it's estimated that 10 million Americans worked with the chemical. And so among the occupations are automobile and jet engine mechanics, dry cleaners, embalmers, oil processors, painters, and printers. I actually met a gentleman this morning who worked in the printing industry and likely with trichloroethylene when he was a teenager. Shoemakers, taxidermists, varnish workers. In addition, it had a wide range of consumer uses. It was used to clean carpets, it was used to clean guns, it was used in glue, inks, lubricants, used to produce pesticides, refrigerants, and even typewriter correction fluid. And then it had a wide number of industrial and military uses. Almost all the information here is in the book as well. And if you were exposed to any of these or to paraquat, please come talk to me afterwards. This is how I learn. I learned from your stories, and the book is basically filled with stories of individuals and how they got Parkinson's disease. And those who are more scientifically inclined can read all the research studies. There's 60 pages of references at the end of the book. And so some people are exposed to trichloroethylene because of their work or their hobbies, but you need not have to work with it to be exposed. You could be exposed to trichloroethylene in your environment. Many of you know about Superfund sites. How many people know about Superfund sites? Superfund sites are the most toxic sites in the United States. They're designated by the federal government for cleanup, usually, ideally, at the cost of those who polluted it. And so this is a map there are about 1,300 of these Superfund sites throughout the United States. Over half are contaminated with trichloroethylene. So the number one reason for contaminate for Superfund sites are trichloroethylene. Any people seen the movie A Civil Action? Anyone see the movie A Civil Action with John Travolta? That was trichloroethylene contaminating a town called Woburn, north of Boston. I don't know if people grew up near Toms River, New Jersey, also contaminated with trichloroethylene. Many of you know about the Marine base Camp Lejeune. So the Marine base Camp Lejeune is a Marine base in North Carolina where this was in its drinking water between 1953 and 1987. Trichloroethylene and perchloroethylene, known to cause cancer, was in the drinking water of Marines in North Carolina, and the Marines drank this TCE in the water from 1953 and 1987. And it wasn't just the Marines, it was their family members, their children, and civilians. In all, 1 million people were exposed from 1953 to 1987. And the Marines knew about it in the latter years. The Marines knew about the exposure, the toxic chemicals, and they did nothing about it. It took an act of Congress for the Marine Corps to even notify Marines of their exposure after the fact. And then Dr. Tanner and Dr. Sam Goldman studied the Marines. And you know, if you're a Marine, a couple things. First of all, thank you to all the veterans. I see lots of veterans in the room. How many veterans in the room? Can we thank them? So they studied the Marines. Almost by definition, if you're a Marine, you're healthy. Almost by definition, you're young. On average, their average age was 20. Some were teenagers when they were exposed. And they're only there for a short period of time, right? You don't stay at a military base, you move from base to base. They were there for an average of just over 2 years, 25 months. Yet, 34 years later, those Marines had a 70% increased risk of Parkinson's disease, just from serving. And that's not the only chemical that's linked to Parkinson's. Many of you know about Agent Orange, another weed killer. It's also linked to Parkinson's disease. So the book, the two protagonists of the book are two women, athletes, served in the U.S. Air Force Academy, became physicians, served their country, including in Afghanistan. Both became mothers, both had daughters, and both were diagnosed with Parkinson's disease in their 40s within 1 month of each other. So those are the two protagonists. They're the two protagonists of the book. And then I asked them, can you send me the bases where you served and when you served? And they sent me their long list. And each of them had served at like 10 to 12 bases. Over half the bases where they had served were contaminated with trichloroethylene. And Dr. Sarah Whittingham, who's an anesthesiologist, is really fired up. And she says the price of service should not be unnecessary exposure to toxic chemicals. The price of military service should not be unnecessary exposure to toxic chemicals. She's so concerned that her oldest daughter is like about 17 and is thinking about what to do next. And she had prepared her to join the military, to serve like she had. But now she says she no longer wants her daughter to serve because she's afraid of what exposure she might have. And as you can imagine, if you're serving your country for 20, 30, 40 years, that's very disheartening to say to your daughter. There are lots of sites. There are lots of sites. There include sites here in Fort Worth, Texas. So this is just one that our great team, Josephine and Julia, found. This is a former military aircraft manufacturing facility called Air Force Plant 4. Anyone know about this? Yeah, so everyone knows about this. So it employs 15,000 people, and TCE, trichloroethylene, a plume was discovered in 1982. That doesn't mean the plume was just started in 1982. That means when we discovered it. It was likely, when you discover something, it was likely there before you discovered it. And so the plume is because trichloroethylene sometimes inappropriately disposed of. Sometimes it leaks from an underground storage tank. Sometimes it leaks from a sewer line. And it gets into the groundwater. And the groundwater is 15 to 50 feet below the surface, depending on where you live. I'm a neurologist, not an engineer. And so trichloroethylene can get into the groundwater, kind of like how pesticides can get into the groundwater. And then it can form pockets of concentrated trichloroethylene. And once you get in the groundwater, you can move. You can migrate. So you don't have to just be right where it was at the source of contamination. You can be simply living, working, or studying near where the contamination is. And many of you know that radon can evaporate from underlying soil into your home and cause lung cancer. Trichloroethylene can evaporate from underlying groundwater or soil and cause cancer, and likely contribute to Parkinson's disease. So this plume was found in 1982, and it was found in the groundwater at above a water aquifer at unsafe levels. And there are elementary schools that reside within a half mile of this location. In Franklin, Indiana, a different source of contamination, trichloroethylene contaminated got into the underlying groundwater and soil, and 80 children in Franklin, Indiana, south of Indianapolis, developed cancer. 80 children developed cancer, including Emma Reinhardt, who was 12 years old and died of a rare brain cancer that's found usually in adults, not in children. And she dies, and the chemical was found inside of her school. Diseases like leukemia, just in general, diseases have causes. Diseases have causes. That's the central tenet of Western medicine, is that diseases have causes. You don't get Parkinson's because of the sins of your father. You get Parkinson's because for reasons either environmental or genetic or other. And the principal reason for these diseases, many of them, are not genetics. Genes only account for 30% of health generally, much less that for Parkinson's disease. Diseases have causes. If we figure out what the causes of the diseases are, we can prevent people from the suffering that they're experiencing. This is air pollution. So one of my colleagues, Dr. Brittany Krzyzanowski, is a geographer, and she mapped out areas of the country that had high levels of particulate matter, the little pieces of dirt and soot, and high levels of Parkinson's disease. And then she mapped out areas of the country that had low levels of particulate matter and low levels of Parkinson's disease. The areas with high levels of Parkinson's disease and high levels of particulate matter are in red. And you guys know your Texas geography better than I do, but that might extend to, or is Fort Worth in that pocket? Thank you. And then also in the Ohio and Mississippi River Valley. So if you look at a map of Parkinson's disease, this is those are the areas that are the highest areas. And the Mountain West has low levels, or used to have low levels of air pollution and low levels of Parkinson's disease. Of course, the Canadian wildfires are changing some of that. And then air pollution is, as much as the association is with Parkinson's disease, it's very strong with dementia. So if you don't want to get dementia, don't breathe polluted air. And then so some of you are like, is it too late? I'm going to say it's not too late. I'm going to give you all the bad news first, and then I'm going to give you all the good news after. So it turns out we looked at what were the most polluted cities in the United States, and not surprisingly, Los Angeles has the most polluted air in the country, but Fort Worth was second. Fort Worth was second. And a 2016 study found that 90% of Texans reside in areas where the particulate matter, PM, is higher than that recommended by the World Health Organization. And so it's not too late. So I'm going to give you, in one study called the Nurses' Health Study, looked at nurses in the United States. Any nurses in the room? We got nurses in the room, yes. Thank you. So nurses who are cognitively normal and age 70, individuals who lived in polluted parts of the country had greater rates of cognitive decline than people who lived in less polluted. So even when you're a seasoned senior, you can decrease your likelihood of developing dementia by breathing clean air. And even if you have Parkinson's disease, it turns out that people who are exposed to high levels of air pollution are more likely to be hospitalized for their Parkinson's disease. So breathe clean air. Now you're going to say, how do we do that? I'm going to tell you in a second. So in our book, we say we can prevent the disease, and for individuals who already have the disease, we can possibly slow it. For individuals who already have the disease, we give you 25 recommendations called the Parkinson's 25 to possibly slow the rate of progression of Parkinson's disease. 25 recommendations to minimize your exposures to paraquat and other pesticides that might be in your food, 25 ways to decrease your exposure to chemicals that might be in your water, and 25 ways to reduce your exposure to air pollution. In addition, we give you 25 things that you could do in your community. So in the process of writing this book, I found out that pesticides are routinely sprayed on kids' schools and playgrounds. Do people know this? I was like, wow. And we ask, why do 1 in 31 8-year-olds in the United States have autism? And we have the audacity, we are doing the spraying of the pesticides on kids' playgrounds and schools, right? We're paying the taxes, right? We're on the PTA, right? It's our kids and grandkids that we're allowing this to happen to. So, everyone in here, you're in Texas. You're not shy. You have voices. You can call up your school and say, are you spraying pesticides on our kids' playgrounds and schools? And can you please stop? Right? Everyone can do that, right? And in California, a woman, Robin Sewell, did exactly that. She dropped off her 5-year-old child in kindergarten in Sherman Oaks Elementary School in Los Angeles. And she dropped off her child, and a man in a hazmat suit is spraying pesticides. And her 5-year-old son has an asthma attack in front of her. The 5-year-old runs back to his mommy going, Mommy, is this ever going to happen again? And she said, no. And 2 years later, California passes the Healthy Schools Act, which prevents schools from spraying most toxic pesticides on kids' schools and playgrounds. And if they do, they must notify parents in writing in advance of such exposures. Could Texas do the same thing? In addition, Dr. Brittany Krzyzanowski, who did that study with air pollution, showing that high levels of particulate matter in Texas and high levels of Parkinson's disease in Fort Worth, she did another study showing that in Rochester, Minnesota, if you live within a mile of a golf course, you have a 126% increased risk of developing Parkinson's disease. If you live within a mile of a golf course in Rochester, Minnesota, your risk of Parkinson's disease was double. Golf courses use up to 80 times as much pesticide per acre as farms do. So many people here belong to golf clubs. Can we ask our golf courses to use less toxic pesticides? Can we ask them to use less pesticides? Can we tell them to spray less frequently? And can we tell them to notify you in advance if they're doing spraying? Right? We have noise ordinances, right? I can't turn up my stereo really, really, really loud and do that without consequences. Why do we let organizations spray toxic chemicals into the air that are increasing our risk of Parkinson's disease? So when I see Parkinson's disease, one, I get pissed off because I think a lot of it's preventable. And second, I see robberies. I see people robbed of their independence. I see people robbed of their golden years. I see people robbed of their employment. I see people robbed of their enjoyment. I see people robbed of their money. I see people robbed of their time. I want the robberies to end. I want Parkinson's disease to end in our generation. That we are the generation that says no more to these chemicals in our food, water, and air, no more to Parkinson's disease, no more to autism, no more to ALS, no more to Alzheimer's disease. Brain diseases are now the world's leading source of disability. Brain diseases are the world's leading source of disability, more than cancer, more than heart disease. For the 200,000 years of human history, that has never been the case. For 200,000 years of human history, that's never been the case. There are reasons that people are getting these diseases. We need to figure out why they're getting them, prevent them, end them, so people are not bearing the burden of these terrible diseases. And then there are actions we need to do as a society. We need to ban paraquat. Can Texas be the first state, I think the first state in the union to ban paraquat? Right, this has been around for 60 years. I'm a product of suburbia. I know nothing about farming. But I strongly suspect that most farmers are not using tractors from 1963. I suspect that most farmers are not using irrigation systems from 1963. I suspect that most of you drove here in cars not from 1963. And I'm not flying home to New York City in an airplane from 1963. If engineers can come up with safer modes of transportation, chemists, including chemists from TCU, from Texas, from the United States, can come up with safer weed killers. So here are the Parkinson's 25. We give you, if you do not like to read, you can go to the Reader's Digest version of the book on page 237. All of you have a copy. It's the Reader's Digest version, and we give you 25 ways to reduce your risk of getting Parkinson's disease for your children and grandchildren. So I see some young people in the audience. The seeds of Parkinson's disease are planted early. So if you want to retire when you're 60 and 70 years old and not get Parkinson's disease, pay attention to what your exposures are now. And if you already have the disease, these can possibly slow the progression. I'm going to give you an example. If you are a smoker and you're diagnosed with lung cancer, what's the first thing the doctor is going to tell you to do? Stop smoking. But if you're a farmer and you're diagnosed with Parkinson's disease, what is the neurologist not telling you anything about? Pesticides, right? And so within minutes of smoking your last cigarette, your heart rate normalizes, it goes down. Within hours of smoking your last cigarette, carbon monoxide levels drop in your blood. Within a year of smoking your last cigarette, your risk of heart attack has decreased. Within 10 years of smoking your last cigarette, your risk of lung cancer is halved. So if this is true for lung cancer, what could happen if we stop getting exposed to pesticides, if we stop getting exposed to dry cleaning chemicals, if we stop getting exposed to air pollution? We might slow the rate of progression of the disease. And we know that for people with Parkinson's disease, some people have a slow rate of progression and some people have a rapid rate of progression. I think one of the reasons is some people have stopped getting exposure to the chemicals and some are still getting exposure. So we give you 25 recommendations. I don't think I can read them from here. But the first one is to wash your produce, even your organic ones. And remnants of pesticides are found in 20% of common foods in the United States. So 20% of the food that you eat in the United States that's conventionally grown with pesticides has residues of pesticides. Even organic produce, dairy products, and meat, which all have generally have lower levels of pesticides on them. Some of them still have pesticides, and some still have unsafe levels, right? Concerning in and of itself. So I wash all my produce with water. So I get my apples from the store. I buy organic ones. I put them in a glass bowl. I fill it with water, and I add a little bit of soap, a little bit of vegetable wash. Just like we wash ourselves with water and soap, I wash my produce with water and soap because some of these pesticides dissolve in fat, and they don't wash off as easily without soap. I wash them for 2 minutes, I give them a bath, and then I put them in the basket so I can eat them later in the week. By the time you're diagnosed with Parkinson's, 60% of those nerve cells that produce dopamine have died off. You want to protect the remaining 40%. You want to protect the remaining 40%. Do not minimize your exposure to these toxic chemicals. Number 4 is enjoy organic wines. There's no reason that we need unnecessary exposure to these chemicals. Number 3 is making sure your grocery store is safe and not near a dry cleaner that's using trichloroethylene or perchloroethylene, because these chemicals are fat-loving. And in Germany, they looked at the butter and the cheese in grocery stores next to dry cleaners, and they found these chemicals in the butter and the cheese. Number 10, almost I give a little endorsement here for air purifiers. So I live in New York City, which doesn't have fantastic air quality. So we have an air purifier in our living room and an air purifier in our bedroom. If I lived in Fort Worth, I would definitely do the same. Don't poison yourself. So you're not spraying nerve toxins on your yard. You're not spraying nerve toxins in your home. You're not exposing your kids and grandkids to nerve toxins by spraying. Dry clean cautiously. If you're dry cleaning clothes, do not use a chemical called perchloroethylene. The cousin is called perc in the dry cleaning industry. Find a green dry cleaner. And so we give you 25 recommendations like this, page 237. You can just jump straight ahead and figure it out. It'll take you 20 minutes at most to read them all. Then we need to take action at the local level. We've talked about the need to create pesticide-free schools. If you create pesticide-free schools in Texas, I'm coming back here to celebrate with you because you can prevent intellectual disabilities, you can prevent ALS, you can prevent Parkinson's, you can prevent cancer by getting rid of pesticides in our schools. And then we need to learn why this disease starts. Out of every Parkinson's research dollar, only 2 cents is spent on preventing the disease. There are homes sold for more money in Miami, Florida, and Los Angeles, California every day than we as a society spend on preventing Parkinson's disease. And we wonder why Parkinson's disease continues to rise. If you don't know the cause of a disease, you can't cure it, it's hard to treat it, it's really hard to slow it, and you can't prevent it. We need to figure out what the causes of Parkinson's are. I give you 3. There are likely others, and they might vary by geography. People who grew up in rural areas, pesticides might be more important. If you grew up in an industrial area or worked with these chemicals, these chemicals could be more important. If you're living in Fort Worth, air pollution might be contributing. The economic costs, beyond the human cost of Parkinson's, the economic costs of Parkinson's are enormous. So for every person in this room who has Parkinson's, the Michael J. Fox Foundation funded a study and estimated the economic burden of Parkinson's disease to each one of you in this room is $50,000 per year. Half of that's from Medicare in terms of higher healthcare expenses, more doctor's visits, more speech therapy visits, more medications, more surgeries. Half of it paid for by us. And the other half is paid for by the individuals. Lost wages, increased caregiver time, medical co-pays, and the like. $50,000 per person. There's over 1 million Americans with Parkinson's disease. If you do the math, 50,000 times 1 million, you get to $50 billion, a lot of money. If we prevent just 1% of Parkinson's disease, just 1%, just from, say, paraquat, 1%, the economic value of that is $500 million per year. What's $500 million? That's twice what the National Institutes of Health spent on Parkinson's research last year. That's more than the Michael J. Fox Foundation, which spends more money funding research than any other organization, more money than they spend annually. And that's more than the global sales, not profits, global sales of paraquat, according to the reporting from The Guardian. We would be better off as a society writing a check to the makers of paraquat for $400 million to tell them to stop spraying than we are to let them continue to do so. That's just if 1% is preventable. If it's 10%, that's $5 billion per year. And then we need to amplify the voices of people who are affected. Many of you remember the March of Dimes. Remember the March of Dimes? So in March of Dimes was created in 1938 because President Franklin Delano Roosevelt had polio and he didn't want other people to get polio. And we didn't actually know what the cause of the disease were. We suspected it was a virus, but we didn't know what the strains were. We figured out what strains of polio were what strains of the virus were calling polio. 17 years after the March of Dimes began, Jonas Salk held up a vaccine in Pittsburgh, Pennsylvania. Some people remember this. And we live in a world that's largely free of polio. 17 years. In 1980, a 13-year-old girl is struck by a drunk driver and killed in California. 4 days after she's buried, Candace Lightner found her voice and went to the governor of California every day for a year, because in 1980, drinking and driving is legal in some states. Drinking and driving was legal in some states in 1980. And 8 years later, drinking and driving is illegal in all 50 states. Drinking age is raised from 18 to 21. Blood alcohol levels drop to 0.08. 10,000 fewer people die per year from drinking and driving because Candace Lightner found her voice. Now, she could not bring her daughter back, right? She could not bring her daughter back, but she said to herself, I don't want other mothers to experience what I experienced. 10,000 fewer children, 10,000 fewer schools, 10,000 fewer families, 10,000 fewer communities are torn apart because Candace Lightner and Mothers Against Drunk Driving found their voice. Thank you to any of the people that were members of MAD. In 1987, HIV is running rampant in New York and in San Francisco. People are blamed for their conditions. Doctors refuse to care for people with HIV. Some of the most prestigious hospitals in New York City refuse to admit patients with HIV. And there was President Reagan was a little bit slow to respond to the crisis. And so an organization founded by the late Larry Kramer called ACT UP, which is highlighted here in this picture, was formed. And they adopted this slogan of silence equals death. Silence equals death, because for people with HIV, if they remained silent, they would have died. In fact, people who lived were just those people who lived long enough to get AZT in the late 80s or to get protease inhibitors in the 1990s. Because the HIV activists found their voice, federal funding for research expanded. They barricaded themselves in the streets. They took over the streets of New York. They took over the New York Stock Exchange because a pharmaceutical company had the audacity to come up with an effective treatment, but to price it too highly. And they wanted to make sure that everyone had access to the drug. Because of their activism, I and possibly many people in this room do not have HIV. Today, HIV is preventable with a condom and is treatable. In fact, more people receive appropriate treatment for HIV in the United States and worldwide than they do for Parkinson's disease. And the number of new cases of HIV is at its lowest level since 1990. It's possible that HIV might disappear as a major clinical entity in our lifetime. Inconceivable to any of you my age or older, right? We thought this was a plague and that this was going to destroy millions of people's lives, and it did, but we've changed the course of HIV in a relatively short period of time, right? So if we can do this for polio, if we can do this for drinking and driving, if we can do this for HIV, we can certainly do it for Parkinson's disease. But we cannot be silent, right? For Parkinson's disease, silence doesn't equal death. Silence equals suffering. All of you want better treatments. So Michael Oken in chapters 8 and 9 of the book tell you about the most promising treatments in the near term, including pumps for levodopa. Most promising treatments in the midterm, the next 6 to 10 years, including new deep brain stimulators that not only stimulate the brain, but actually sense brainwave activities. The same electrodes that are put into people's brains to stimulate them can, in the future, sense brainwave activities and modulate the stimulation based on what they're sensing. Kind of like people who have an insulin pump that can sense the amount of glucose in people's bodies and then dial up the insulin or down based on the levels. And then what's out in the long term, including crazy things like nanobots, little tiny little delivery vehicles that can deliver drugs to the parts of the brain that are affected in Parkinson's disease. So what are our goals? In the book, we articulate 3 goals for 10 years from now. So if Chris is nice enough to invite me and the families are nice enough to have me come back in 10 years, we can celebrate these 3 goals. But by 2035, that everyone who has Parkinson's disease has access to levodopa. Everyone who has Parkinson's disease should have access to levodopa. There are many countries in the world where levodopa is not accessible, even though it's cheap. In the United States, it's less than $1 a day. It's been around for 60 years. It's safe, and it's highly effective. More people have access to treatments for HIV, which are more expensive, more complex, more dangerous than they have access to levodopa. We do not find it socially acceptable for people with HIV to go without treatment. We should not find it socially acceptable that people with Parkinson's disease go without treatment. Second goal is 10. We need to increase the amount of research funding for Parkinson's disease tenfold. $250 million a year of NIH funding is not going to get the job done. $250 million is not going to get the job done. In the last 9 years, funding for Alzheimer's disease has increased 7-fold. 7-fold increase in 9 years. Why can't we do 10-fold in 10 years for Parkinson's disease? And we're starting to see perhaps the first treatments for Alzheimer's disease that might modify the disease course. And then we can't get around spending 2 pennies out of every research dollar on preventing the disease. We need to increase that 10-fold to 2 dimes. So we find out what the causes of the disease are, so we can cure it, treat it, slow it, and prevent it. And then perhaps most provocatively, and the one I'm most focused on, is trying to stop the rise of Parkinson's disease. By 2035, we want to see a 0% rise in the incidence of Parkinson's disease. That the Parkinson's disease is no longer the fastest growing brain disease, it has stopped. So that by 2036, we start talking about the fall of Parkinson's disease. Diseases come and go. We didn't have infectious diseases until we had the agrarian revolution in cities. There was no smallpox for the vast majority of human history. Only when we formed cities and had people come in close contact with another did we get infectious diseases. And we've said goodbye to a lot of these. No one worries about smallpox. Diseases can come and go. Parkinson, for 99% of human history, Parkinson's disease was extraordinarily rare, right? The first major description of Parkinson's disease wasn't until 200 years ago when Dr. James Parkinson wrote his essay Among the London Fog in London in 1817. For 99% of human history, Parkinson's disease has been a bit player, if not existent at all. We can create a world without it. And in fact, the number of new cases of Parkinson's disease adjusted for age appears to be decreasing in the Netherlands and already decreasing in Germany, 2 countries that have gotten rid of a lot of these pesticides, including paraquat, 2 countries that have said goodbye to trichloroethylene. This has been around for 100 years. 100 years of causing cancer is enough. And 2 countries where air quality has substantially improved. If Germany can do this, if the Dutch can do this, then certainly Texans and certainly Americans can do the same. We can create a world where Parkinson's disease is no longer rising, but where Parkinson's disease is falling. And we're making some progress. So in 2021, the EPA banned the use of a pesticide called chlorpyrifos. If you've ever eaten an apple in the United States, you've likely eaten chlorpyrifos. In the lab, chlorpyrifos kills dopamine-producing nerve cells. In 2021, the EPA banned it. Unfortunately, the manufacturer sued, and the fate of that ban is unclear to me. In 2024, Congressman Gus Bilirakis, a Republican from Florida whose brother died with Parkinson's disease, whose father has Parkinson's disease, introduced a bill with Congresswoman Jennifer Wexton, a Democrat from Virginia, who has a rare Parkinsonian disorder called progressive supranuclear palsy. That's Congresswoman Jennifer Wexton. Her PSP forced her to not run for re-election. And that's Congressman Gus Bilirakis. Someone mentioned that they saw a C-SPAN interview, and Congressman Gus Bilirakis was there. They introduced a bill called the National Plan to End Parkinson's Act. requiring the federal government for the first time to come up with a federal plan to prevent, treat, slow, and cure Parkinson's disease. Right now, there is no such plan. Right now, the federal government has no plan to address the Parkinson's pandemic. And this bill passed the U.S. House 407-8, passed the Senate unanimously, and was signed into law by President Biden in July of 2024. That bill, which is now the law, requires an advisory council to be formed. On that advisory council to be included are individuals with Parkinson's disease and caregivers. And that advisory council should be created and led by people with Parkinson's disease, and we should stop waiting for that advisory council to be formed. Every time we delay, we allow more people to get Parkinson's disease, and we allow the suffering to continue. In December 2024, the EPA banned trichloroethylene and perchloroethylene. I said that future generations cheer. Unfortunately, that ban was frozen in 2025, but it looks like that freeze is going to be ended, and that the ban will be put into place, and that use of these chemicals will be phased out over the next 10 years. Unfortunately, that does nothing to address the contaminated sites, for example, in Fort Worth. And then we need to ban paraquat. For 60 years, it's been sprayed in the United States. Over 50 countries, including China, have banned it. England bans it, does not allow it to be used on the British population, but exports it to Brazil, Mexico, and the United States. And then, as Chris said, I work for a new organization that's focused on preventing diseases. It wants to transform healthcare from reactive sick care to proactive preventive care. And with Josephine, we're creating a center focused on the brain, the environment, to identify the environmental causes of brain diseases from autism to Alzheimer's disease, and to prevent them so that fewer people are affected by these diseases. We're going to do that by measuring chemicals in people's bodies. So for example, everyone here had, 95% of us in the room had unsafe levels of lead in our blood when we were kids. 95% of us had unsafe levels of lead in our blood. And then we got rid of lead in gasoline and lead in paint. The world did not spin off its axis. The cars kept driving. We were able to paint without lead in paint and lead in gasoline. And today, our grandchildren had levels that are 95% lower than ours. So if you wonder why your kids and grandchildren are smarter than you are, there's a reason for doing so. And then we need to measure these chemicals in our environment. What chemicals are lurking in our water? What chemicals are lurking in our soil? What chemicals are lurking in our household dust, in our air? And then can we map out clusters of the disease? So if you want to learn more about these studies or possibly participate, you can sign up for our registry right outside with Josephine. This is what we're trying to do to find out what the chemicals in our bodies, in our environment, so that we can get rid of them, so we can all live longer, healthier lives without these terrible diseases. And we're here, and I love this motto, which is End Parkinson. That was actually the name of our first book, End Parkinson's Disease. And people like you change the course of diseases. People like you change the course of diseases. And diseases, their course is really changed by people who are most directly affected, who most intimately know, like Candace Lightner, the suffering that comes from losing a child, the suffering that comes from having Parkinson's disease, the suffering that comes from caring for someone with Parkinson's disease. If you make your voices heard, we change the course of this disease. And we can do that as individuals. There's a global grassroots organization called the PD Avengers, founded by, led by people with Parkinson's disease. They want you to join up. Anyone can join, your children, your grandchildren. I have signed up. You can go to pdavengers.com. It takes 30 seconds to do. It's free to do, and you get a free newsletter from doing so. You can sign up for our registry for research. If you're fancy and tech savvy, you can scan our QR code. If you're not tech savvy, you can just go to Josephine and give us your email. We can get rid of pesticides in our kids' schools and in our golf courses, or we can certainly use less. And then we need to ban paraquat. The EPA administrator is Lee Zeldin. He works for you. The government works for you. You pay his salary. You can email the Administrator Lee Zeldin at zeldin.lee@epa.gov and say, Dear Administrator Zeldin, thank you for your service. Please ban paraquat. 30 seconds. If 1.2 million Americans make their voices heard, we can change the course of disease. We can get rid of paraquat on our farms in Texas. We can get rid of pesticides in our kids' schools and playgrounds. We can tell golf courses to find safer pesticides to keep their grasses green, and we can create a world without Parkinson's disease. Thank you very much. Huh? Oh, this one.
Okay, we're going to open the floor for questions. How we'll do that, we got a couple of microphones. If you have a question, raise your hand, and we'll come to you with a microphone, okay? And hopefully the microphones will work. We'll start over here, and then we'll alternate which mic we're using, okay?
Real quick, kind of curious, your slide deck, is it available? Do you have it to where we could access it? Because there was a lot of information there.
Yes, we'll make it available to Chris, and it's also almost all the pictures, except for the ones that are specific to Fort Worth, are in the book.
Got it. One other question, just real quick, scuba diving. Any correlation between that and the information you provided?
I think scuba divers are safe.
Okay. Good deal. The only other thing is too, the Air Force Plant 4 that they mentioned.
Yes,
I
sir.
actually work there. I work at the Lockheed facility, which shares the runway with it. How can I find information about, the exposure level and stuff like that?
I'd ask. We did this from an internet search. We did nothing more than search Fort Worth plus trichloroethylene. That's what I do. As I Google Fort Worth or whatever city I am and trichloroethylene, I almost always find something. So find out and let me know. You can email me, info@pdplan.org. I read every email that comes in, info@pdplan.org. This is how I learn. This is how we write the books. This is how we get the word out, because people like you tell me their stories, and that's how I learn.
Well, one final question.
Yeah.
Dermal absorption versus inhalation or ingestion?
Yeah, so in 2003, the question is, where does Parkinson's disease begin? I'll generalize it. In 2003, a really smart German pathologist named Heiko Brock said that Parkinson's disease, which we think of as a brain disease, does not begin in the brain. Parkinson's disease, a brain disease, does not begin in the brain. He says, when I look at people's brains underneath the microscope, I see the pathology most commonly in two locations. One is the smell center that we talked about, and the second is in nerve cells that go to in the nerve bodies for the vagus nerve, which is a nerve that goes from the lower part of our brainstem all the way to our gut. So he said that he thought that Parkinson's disease in 2003 might be due to neuroinvasion of an infectious particle that starts in your gut and then spreads up the vagus nerve, and then from the vagus nerve up to different parts of the brain. He said that the spread of this pathology, which can spread from nerve cell to nerve cell, he says like a fall of a row of dominoes, that the pathology spreads from the vagus nerve upwards to different parts of the brain. So some people with Parkinson's disease, for example, the earliest feature of the disease is constipation, right? A lot of people constipation. And then some people early in the disease course get sleep disturbances, which is part of the brain called the locus ceruleus that gets affected. Some people with Parkinson's disease get early troubles with managing their blood pressure. They get really lightheaded very easily. And so that's what he thought. In 2019, my colleague, Dr. Per Borghammer in Denmark, said there are two forms of Parkinson's disease. There is a gut or body first form of Parkinson's disease that starts in the gut and then spreads upwards. And there is a nose or brain first form of the disease that starts in the smell center and then spreads backwards. Two forms. Some people have a predominantly gut first form. Some people predominantly have a nose first form. Good so far? So I printed out all his papers I like to read. On Sundays, my reading day. And I marked them all up, and I thought to myself, and I sent him an email. And I said, Dear Dr. Borghammer, great work. How does your research align with chemicals that we ingest, leading to a gut first form of the disease? And how does this fit with chemicals that we inhale that would lead to a nose or brain first form of the disease? He was skeptical. We worked on him, and we wrote a paper called The Body, the Brain, the Environment, and Parkinson's Disease, in which we articulate that. It's in chapter 4 of the book. So that people who are inhaling trichloroethylene, who are inhaling a paraquat, are maybe perhaps more prone to a nose or brain first form of the disease, whereas people who are ingesting the chemicals, pesticides in well water, Marines at Camp Lejeune, are getting a body first. Now that's greatly overly simplified, but that's one way. Skin is a little more complicated, and in that paper that we wrote together, we said that we need more research on skin.
Dr. Dorsey, why don't you try that microphone there?
Hello.
Questions?
Is this Texas hospitality? Maybe this works. Wow, there we go. Maybe. All right.
Dr. Dorsey,
Yes.
I see in your book and everything, all the military studies and all the bases and everything, and the VA finally is doing some studies on Agent Orange exposure.
Yeah.
The question is, like Camp Lejeune, is there any tie between the veterans at the bases and the dependents or wives or children? And what I noticed that there seems to be zero lack of correlation that they treat the veteran before the family.
Yeah. The Marines who served at Camp Lejeune are entitled to compensation and benefits if they've developed a list of diseases that includes Parkinson's disease at Camp Lejeune, but family members are not entitled to it. I don't know if many of you know Brian Grant is a former NBA basketball player with Parkinson's disease. He has the Brian Grant Association or Foundation, and I read his autobiography, and at last chapter he says that when he was a young boy, he was living at Camp Lejeune. Camp Lejeune, these Marine military bases, think of them as like TCU. They're like huge campuses. They're not just like a small little isolated thing. They have a Walmart, they have a dry cleaner, they have an elementary school, they have a pizza place, they have dry cleaners, and they're located. So there were 1 million people, Marines, their spouses, their dependents. Camp Lejeune came to light because a drill instructor, the daughter of a drill instructor, Janie Insminger, developed leukemia at age 6. Trichloroethylene causes cancer, and she dies at age 9. It tears apart his family, it strains his relationship with his other daughters. He and his wife get divorced, and then years later, after he's left the Marine base, he hears that cancer-causing chemicals are at Camp Lejeune. So the reason Camp Lejeune came to light is because Jerry Insminger, a Marine, a drill instructor, he said it wasn't just my daughter, right? It was all the sons and daughters of all the Marines I was training and all their spouses and their families. And he's a Marine. He's straight out of Central Casting. He says, leave no Marine behind. And after 24 years of serving his country as a Marine, he's devoted the last 27 years and counting to bringing justice for those who served at Camp Lejeune, including their family members. His partner is Mike Partain, who was conceived at Camp Lejeune, and he later develops male breast cancer. So many male Marines developed breast cancer at Camp Lejeune that they created a swimsuit calendar of all of these men showing off their mastectomy scars. So it's not just the Marines who are at risk. Marines and military pay a disproportionate price. They are about 6% of Americans are veterans, but 10% of people with Parkinson's disease are veterans. But it's their family members and others. Yes.
I have 2 questions. One is about brain injury. I had read that if you have a brain injury as a child or a young person, that might be a factor in getting Parkinson's.
Okay. Yes. Thank you. If you raise your hand, I can see you. So yes, a single traumatic brain injury with loss of consciousness increases your risk of developing Parkinson's disease by about 50%. It turns out that not every farmer gets Parkinson's disease. Not everyone who works with trichloroethylene gets Parkinson's disease. Not every Marine who served at Camp Lejeune gets Parkinson's disease. Only 10% of smokers get lung cancer, right? So there have to be other factors. And I think one of the factors is, can you have interactions with other environmental risk factors like head trauma? So it turns out if you have paraquat, you increase your risk. If you have head trauma, you increase your risk. If you have paraquat exposure and head trauma, your risk is greatly amplified.
Also, this is a specific question.
Yes.
Regarding water purifiers.
Yes.
Is a refrigerator water purifier enough, or do you need a more, you need the...
Yeah, so I'm a poor neurologist, and I'm like, I'm having to learn about water filters. I don't know what refrigerators. You want a water filter that's a carbon filter that reduces exposure to pesticides, for example. The ones you get in grocery stores work, and that's what I used when I was in Rochester, New York. I just put a water filter on my kitchen faucet, and when we use water for drinking or cooking, we used that. In New York City, we just have this basically almost like a pitcher that has a water filter in it, and so we fill that up every day and use that water to drink. I don't know what the filters are in refrigerators. I just don't know.
Let's go to the other microphone.
Thank you, and thank you, Dr. Watts, for bringing him to Fort. We have Mayor Mattie Parker, we have Taylor Sheridan right down the road. Why do we have to go big before we start local? What can we do right here in Fort Worth? How many people are in this room? How do we do the
Yeah, I would do it with the schools. I mean, why not TCU? I mean, why can't TCU use less pesticides than it does? Why are we exposing 18 and 19-year-old kids to pesticides? There are 3 studies that link soccer playing to ALS. 3 studies that link soccer playing to ALS. Well, why would soccer players be at risk for ALS? Well, 1, they're getting head trauma, right, so the earlier question. And 2, I think they're getting exposed to pesticides. And I think they're absorbing the pesticides through their skin to the earlier question, and I think they're inhaling pesticides. So why can't TCU be the first country in the country to get rid of pesticides on its sports fields and thing? Is this all? It's going to be done. Yeah. Yes, just raise your hand.
Right here.
Yeah, thank you. Good, great.
Excellent talk. Thank you very much. I had 2 questions. Number one, what are the half-lives of the PCE and the paraquat? And secondly, are these also absorbed into the substance of the fruits and vegetables they eat, or are they only on the external surfaces? Thank you.
So in the environment, paraquat breaks down slowly, and so does trichloroethylene. So I think I showed you that military base, that Air Force base. They found the chemical in 1982, but I think the Air Force base has been around since 1943. So these chemicals slowly degrade in the environment. But you can take measures. Many people have had a radon remediation system put in. So if you live near a contaminated site, you can test your indoor air and put a remediation system that sucks the air from underneath your home and vents the chemical above. In the body, they're like in the bloodstream, they're broken down, but some of these chemicals are fat-loving and they live longer in the fat. And like some pesticides like DDT, almost everyone in this room has DDT in their bodies, and we can still find metabolites of it in our blood. Some of these chemicals get in our fat, and the only way we excrete them sometimes is in the milk of nursing mothers. So the milk of nursing mothers can have pesticides in them. And then can the pesticides get into the fruit? I think the answer is yes. Again, I'm a neurologist, not a toxicologist, not an environmental scientist. The environmental working group has like their dirty dozen, the fruits that you should avoid the most because they're most prone to be sprayed with pesticides or contaminated pesticides. I think they have their clean 15 fruits and vegetables that are less likely to have it. But yes, sometimes the pesticides can get into the fruit itself. There we go, right over here. Yes.
I was officially diagnosed in May of this year, and I had symptoms for several years prior. I just learned through your seminar here, I was exposed to TCE in the 70s, early 80s, working for a company called Safety Clean, which is not good to learn, but another thing too is Does Parkinson's lower the mortality of a person?
He shared that he was exposed to trichloroethylene through his work, and then the question is, what is Parkinson's? How does it affect your risk of death? So your risk of death is modestly increased with Parkinson's disease. So if you take a 65-year-old man, just a general 65-year-old American, their life expectancy is about 18 years. So they're going to live to about 83. With Parkinson's, it's about 15 years. So there's a modest increase in mortality. But, people can live long, healthy lives. And, I just emailed Michael Oken and Boss Bloom, and I was saying there are 3 potential ways to really modify the disease course for Parkinson's. 3 powerful ways. 1 is stop getting exposed to the chemicals. 2, exercise. So there are increasing number of research studies that suggest that research is beneficial. And I haven't seen any study that suggests that anything that doesn't suggest that we shouldn't be doing more. I always tell patients of mine at least an hour a day, assuming they can do so, enough to make your heart rate go up, enough to make you sweat. And then if I had Parkinson's, 2 hours a day. And the third is to get really good care. You really, I was in Texas, I was in El Paso, Texas, with 2 people in their 40s, maybe 50, with Parkinson's disease. One is driving around, to most people would look like they didn't have Parkinson's disease. One was standing and almost falling, almost fell in front of me standing. One was getting really good care, one wasn't. Stop getting exposed to the chemicals, exercise, and find good care.
One last comment.
Yeah.
I have 2 daughters who went to TCU, and I think the symbol of TCU is a horny toad, horn frog. And we, about 20, 25 years ago, I started using organic fertilizer on our yard and still do. One of the things that I heard for the extinction of that horny toad was fertilizer running off, chemical fertilizer running off the yards into the water system. Have you heard anything about that?
Yeah, I know less about fertilizers because I don't think fertilizers play a major role in Parkinson's disease, but they have their own adverse consequences, algae blooms and the like. There's just no free lunch. Rachel Carson, when she wrote Silent Spring, she wasn't arguing against the use of pesticides because pesticides had actually saved millions of people from getting malaria in World War II. DDT was used to kill the mosquitoes that spread malaria. In fact, the person who created DDT won the Nobel Prize. What she was arguing about was indiscriminate use of these pesticides. And there are people here who probably ran behind the pesticide truck when they were kids that was spraying out, right? These are people nodding their heads. That's what she's doing. Indiscriminate use, I think, would include, spraying nerve toxins around kids.
We're over here now.
Thank you.
Yes. There's a new medication called Onapgo. Can you talk about that?
Say it again.
Onapgo, which is the medication that they recommending now instead of carbidopa, levodopa.
Is it a new form?
Infusion.
Oh, an infusion. Oh, yeah. So levodopa pump. So there are lots of brand names. I don't even know all the brand names. I'm actually kind of bullish. Full disclosure, I've done consulting for one of the companies that is marketing the levodopa pump. I think this could be really beneficial for people with Parkinson's disease. So people know that with levodopa, you take a pill and the blood levels rise up and people feel better. And then sometimes if they rise too high, they get extra movements, dyskinesias, and then the blood levels fall down, and then they feel terrible, slow, stiff, anxious, tied up like in saran wrap. Take another pill, they feel better, and then they do the cycling over and over again. Wouldn't it be great if the amount of levodopa in our bloodstream could be nice and constant so we don't get these swings? And that's what these medicines can do, is they keep the blood levels nice and constant so you stop getting these swings. Early in the disease, you don't get these swings as much because you have more of those dopamine-producing nerve cells. As those nerve cells die off, you get more of these swings. I think it could be really beneficial. We need to make these things a lot more user-friendly. They're not the prettiest looking things you've ever seen. If you looked at the first pacemakers, they were like these big bulky things. We need to get these things smaller and smaller. And ideally, can we make these pumps, can we tie them so that they can sense how much tremor we're having, hook it up to your watch. And the more tremor you're having, the more levodopa you get, the less tremor you have, you dial it down. So I think this is a promising way of delivering the medicine.
A few moments ago, you mentioned fruit. Can you hear me?
Yes, yes.
You mentioned fruit, something about pesticides. I think you used the phrase dirty dozen and say 15.
Yes.
Could you tell us what those are?
Yeah, I don't actually know what they are. I haven't memorized them, but the Environmental Working Group, EWG, nonprofit, measures these residues of pesticides in different fruits. And I think like, well, I'll let you figure. I get a little worried about. I try not to name names, so we'll just say there's some fruits that are more prone to be have high residues of pesticides on it. They list them for you, and those that are less likely to have residues of them.
Page 120 in the book.
Okay, great. Page 120 in the book. There, we put it in there.
Whenever there's a disease that doesn't have a cure, so to speak, there's room for shenanigans and, gross levels of whatever, thiamine, you name it, out there, and we are the people who are victimized by it. Are you aware of a website or information site that would allow us to at least get a crack at knowing whether it's BS or not?
Yeah. So one of my colleagues, Dr. Benzie Kluger, I think he's trying to create a website like No More BS or BS or something like that. He's exactly worried about advancing treatments that are unlikely to be beneficial. In some cases, it could be harmful. I don't know if there's a site yet. Michael Oken goes through the most promising treatments in chapters 8 and 9 of our book, so that gives you a sense of what we think are the most promising treatments. It's also worth knowing that, sometimes doctors make lots and lots and lots and lots of mistakes, and I included. And we're just sometimes unaware of things that are really beneficial, and we're ignorant, right? And we don't see the suffering. We're just not aware of how bad Parkinson's disease is and the desperation that people have, and that's what we're trying to rectify. Yes.
Yes, before my husband was diagnosed with Parkinson's, he kicked and kicked. I'm talking about 15, 20 years ago, he would kick me so hard, nearly out of bed. Now he's definitely been diagnosed with it, that he's had that REM sleep, which causes him more injuries on his arms and everything. Can you just explain a little bit about that, please? Thank you.
Yes, so remember I said the people who have the gut first form of the disease, it comes up to the part of the brain that controls our bowels and constipation. The next place it goes up to is the sleep centers of the brain. And so people can act out their dreams. So normally, when we're dreaming and we're getting chased by a lion or a saber-toothed tiger, we're paralyzed. But in some people with Parkinson's, they lose that paralysis. So then when they're getting chased by the saber-toothed tiger, they are thrashing and the like, and that's called REM sleep behavior disorder. You dream during a period of sleep called REM sleep, and the behavior is you're acting it out. And it can be very disabling for some individuals. There are, as you probably gather, I'm not the biggest fan of medicine. So there are non-pharmacological ways to doing it. Sometimes pillows between bed partners, for example. The cleverest one I heard was someone said sleeping in a sleeping bag in your bed. I thought that was very clever. Sometimes people end up sleeping in separate beds, for example.
He has a hospital bed that the rails are keeping him in.
Hospital beds with rails to keep them in. And then there are medications, melatonin, and a more dangerous medicine called clonazepam can be beneficial for some people. Yes, ma'am.
I have had an essential tremor for many years, and it's been controlled by medicine primidone. Is that, you had mentioned that we can sometimes have this for a long time and not know it. Is that necessarily or possibly an early sign of Parkinson's?
So there are tremor disorders that have been around for a long time, and Dr. Parkinson, when he wrote his description in 1817, he says, there are lots of people who've had tremor. Indeed, Shakespeare even writes about tremor in one of his plays. And so a tremor with an action, like most classically eating soup or writing your name, or bringing a cup of coffee or a glass to your thing, that's an essential tremor. Versus Parkinson's disease, the tremor is usually at rest. So it's often noticed by a spouse or a family member, why is your hand shaking, as opposed to someone who has the disease when they obviously know that their hand is shaking. It turns out essential tremor, really common. The vast majority of people do not develop Parkinson's, but the risk of Parkinson's among people with essential tremor is higher, but still most people don't develop Parkinson's. We got you right.
I noticed, not to get political, but I noticed that the progress, legislation progress that was done during the Biden era, and all the bans have been done since the Trump group has gotten in there. What is the, what do you suspect will be the future for the approach of NIH, RFK Jr., you had Zeldin up there. What do you think will be the future for the next period of time?
So listen, Parkinson's does not discriminate. It doesn't care if you're a Republican or a Democrat. Quite frankly, it doesn't care if you're a capitalist or a communist. Mao Zedong and Deng Xiaoping both had Parkinson's disease. It's really a matter of making your voices heard. In the 1960s, California's air quality was so bad that the governor of California said we should eliminate all unnecessary driving. That governor was Reagan. Rachel Carson wrote her book, Silent Spring, in 1962. In 1970, the president said we should have an environmental protection agency. That president was Richard Nixon. The person who's the chief Senate sponsor of the national plan to end Parkinson's is Senator Shelley Moore Capito from West Virginia, Republican. Do you know why she was the chief sponsor? Yeah, so I thought, if it has a family member with Parkinson's, or maybe she has Parkinson's. No. She became the chief sponsor because a constituent asked her to do so. And that constituent was a political operative for the other party. If we make our voices heard, politicians in general react. They don't lead. In general, politicians react. They react to the needs and the voices of their constituents. If we make our voices heard, and there's a large voice that's saying in the United States that chemicals in our food, water, and air are fueling the rise of chronic diseases. Right? People are saying chemicals in our environment are causing chronic diseases, whether that's type 2 diabetes, whether that's obesity, whether that's ALS or Parkinson's disease or Alzheimer's disease. And I think they're right. I think we just got to focus on the wrong chemicals and maybe the wrong diseases. But if we get focused on what are the right chemicals that are causing the diseases, and we think Parkinson's is the poster child for that, we create a world without it. But this only happens if we make our voices heard.
We're over here next.
We never knew till a number of years ago how filthy our homes are. And since then, we've been introduced to a plethora of household items that we must use, along with having exterminators come in and spray for bugs on a regular basis. What can you say about all that?
Don't poison yourself. Don't poison yourself. I mean, I went into my garage and I found these chemicals, and some of them, you can read them. Some of the pesticides that are in common used insect killers are pesticides that in the lab kill dopamine-producing nerve cells. If I only have 40% of my nerve cells left off, I am protecting them. I am letting nothing get in there and damaging the remaining 40%. Yes, sir.
There's been some work done in Japan by a researcher named Yamanakata, and he's doing research on stem cells. But they're like, butcher the name, but pluripotent.
Yeah.
Can you speak to that, or where that's going?
So we know in Parkinson's that there are loss of nerve cells that produce dopamine. So about 20 years ago, researchers put stem cells, which are immature stem cells that can be told to develop into dopamine-producing nerve cells or other kinds of cells, into the brains of people with Parkinson's in a clinical trial, largely not shown to be effective. The second generation of those clinical trials are starting to see if we can put stem cells injected surgically, right? Surgery into the brain to produce, see if they can produce dopamine, and that might be promising. I think we talk about that in chapters either 8 or 9 of the book. Now, someone was saying there were some purveyors of less rigorous applications of treatments, and sometimes they might be right, but sometimes it might be wrong. So if you can imagine if you ate a stem cell, what would your stomach do to that stem cell? Break it down, destroy it, thing. If you inject a stem cell into your bloodstream, what's your immune system going to do? Kill it, attack it, right? It's not going to, this foreign material is not allowed in the bloodstream. We have a bunch of cells whose job is to get rid of foreign material. If you inject it into the spinal fluid, what are you putting yourself at risk for? Infection. So just be really mindful of it, but there are legitimate clinical trials that are being done to evaluate whether stem cell therapy might be beneficial for people with the disease. Yes, sir.
At one time, there was discussion about measuring the level of Parkinson's with spinal fluid.
Yeah, so my colleague, Dr. Andrew Sideroff, University of Pennsylvania, and others in a Michael J. Fox-funded study published, I think, either last year or the year before, that there was a marker of misfolded protein in the spinal fluid that can help identify with greater accuracy whether someone has Parkinson's disease or not. Given that's a spinal fluid test, it's primarily be done in research. But the question is, can we find other ways to measure that misfolded protein? So right now, some of you know there's a skin test that appears to be pretty good in terms of finding that misfolded protein in the skin. It can help identify people whether they have the disease or not. Ideally, we could find it in the blood, and then we could give people treatments and see if that treatments can lower the amount of misfolded protein, for example, in the blood. Just like we measure cholesterol and we give people statins, we can lower the level, and that can be a proxy for reducing our risk of heart disease. Can we do something like that for Parkinson's? Yes.
Dr. Dorsey, thank you very much.
Oh.
We have one question for you, and that's for a corner.
Thank you.
I hear you.
Can you hear me?
I can, yes.
Okay, well, I was just wondering the correlation between paraquat and Roundup.
Both are weed killers. Roundup is a pesticide name is glyphosate, and they're used to kill weeds. The health concerns that have been articulated for glyphosate or Roundup is around non-Hodgkin's lymphoma. Paraquat evidently kills the weeds that Roundup can't, and is linked to Parkinson's.
So is there a correlation between Roundup and Parkinson's?
So the research is not very great that links glyphosate or Roundup to Parkinson's disease, and not all pesticides likely contribute to Parkinson's disease. The challenge is that a farmer, for example, doesn't just work with one pesticide. They're exposed to a whole range of pesticides in a mixture. And it could be that the mixture of pesticides, like the mixture of chemicals in smoke, cigarette smoke, could heighten your risk of developing Parkinson's disease. But I think, I'm great confidence that we can get chemists that can find us weed killers that don't kill dopamine producing nerve cells and increase the risk of Parkinson's. In fact, 50 countries are using weed killers that aren't paraquat. So if you have additional questions I didn't answer them, I'll be here afterwards signing books, and then you can also email me at info@pdplan.org. And I thank Chris and the family and TCU very much for inviting me here. We can make this the day that the course of Parkinson's disease changes here in Fort Worth and in Texas. Thank you very much.
Thank you.